We often see children walking on the tiptoes, which we call tiptoe walking. In such cases, children, they put weight on their toes and their heels are off the ground, which we call plantigrade position. In such children, we have noticed a very common problem, that is the flexion of the knee. The flexion of the knee in such children and in such cases is mainly because of two reasons. Number one, there is a weakness in the quadriceps. And number two, as the weight line falls behind the knee, that forces the knee to go in flexion. When the knee goes in excessive flexion, then certainly it causes more instability. Now, when we target a tiptoe walking, then we go for a typical dynamic ankle foot orthosis where we block the plantar flexion and we allow the dorsiflexion. So, plantar flexion blocked means that the tiptoe problem is solved, guaranteed. But when we allow the dorsiflexion, that invite more knee flexion, that cause more knee flexion. So we have often comments from the parents or from the therapist that since we have applied the dynamic ankle foot orthosis to the child, the tiptoe problem is somehow controlled, but we have more issues with the knee because the flexion has been increased. So now what is the solution? The solution is that when you choose an articulation for the dynamic ankle foot orthosis, you can always restrict the movement to few degrees. When you restrict movement, there's no full dorsiflexion, the knee may come in extension. If there is a gross deviation on the knee joint, then you can eliminate all the movement and you can keep the ankle joint blocked. That means don't allow any movement. When the ankle is blocked, then the knee will certainly come in extension. There will not be any sort of unwanted flexion until there is a weakness in the muscles. So when you allow certain movement in the ankle, remember that it has an impact on the knee joint. Whether you allow partially or you allow full, but there is impact on the knees. So when you want to solve one problem in one part of the limb, then try not to create another problem in another joint. So you have to subsequently consider all joints, that what will be the impact of this movement on the other joint, and that is what we call biomechanics. So take care of yourself and your patients. Thank you.